So good afternoon again. My name is Eva Kostecka and I work for the EIT Health Regional Innovation Scheme. And it is my pleasure to be here today to speak a little bit about our organization and also talk about our presence in Latvia and present opportunities for the Latvian stakeholders. And so EIT Health, like fellow organizations present here today, is a knowledge and innovation community of the European Institute of Innovation and Technology. We were created in 2015, so we are almost 7 years present on the European stage. And we connect the needs of patients and citizens with our network to deliver innovative solutions that can positively transform healthcare. The major challenges that our organization is trying to answer to is obviously the fact that Europe is facing a turning point in healthcare, especially now with the rapid spread of COVID, but also over all past 150 years, average life expectancy has increased by approximately 4 to 5 by generation. So we face chronic diseases and multimorbidity. And our role is to help innovators and entrepreneurs to scale and transform the way the healthcare is received and delivered. What does it mean in practice? In practice, we are a pan-European network consisting of almost 150 partners coming from business, industry, research, and education. We are headquartered in Munich, in Germany, but we also have 6 pan-European representation across Europe, and also RIS, which is Regional Innovation Scheme, is one of our flagship programs. So our partners' expertise spans across industry, universities, healthcare providers, research institute, payers, incubators, clusters, and regional authorities. As I said, we are present also in Latvia, mostly in Latvia, with Regional Innovation Scheme. And the purpose of the program is to promote healthcare innovation in the countries with modest and moderate innovation capacity. And our aim here is to match innovators from EIT Health Network with the talent pool and innovative organizations from our EIT Health Hubs regions. So within the RIS program, we offer multiple activities for our stakeholders, such as proof of concept funding for innovation projects, various startup acceleration programs, as well as trainings and workshops. Here are the numbers that we have been able to gather in the past. Well, here is up until 2020. However, you can see that we have reached quite a number with our programs and opportunities. RIS Innovation Scheme is delivered with the help of hubs, so our local partners in Latvia. I'm happy to say that we work with Rīgas Tehniskās University, Medical University. I also believe the representatives of the university are present here today. And that's our basically main Latvian partner. What we offer on annual basis and what we can offer also, and what I would like to speak about here today is, first of all, our innovation call. That is a support that we offer annually to early stage healthcare projects. We offer smart funding up to 75K together with training and mentoring. We have managed to support 28 teams between 2019 and 20. And I'm very proud to say that there has been some great success stories in Latvia with several startups receiving the grants, such as Semantic Intelligence, Coatum, and Hypnos. And this year, Latvia is represented by Veritacell. There is a team which worked on a project which accelerates wound healing. I encourage you very much to contact our Latvian partner for more details. The call is published annually, and for next year, I believe it will be published by the end of this year. Another example of the support that we offer and which can be relevant for Latvian stakeholders is InnoStars Awards. It is a program that supports micro and small enterprises. Here we offer smart funding up to 50K together with training and mentoring, as well as networking opportunities. And one of the biggest success story coming from Latvia here is Vigo, a startup that worked on introduced innovative remote rehabilitation tool. This is basically a rehabilitation assistant that provides digital therapy to patients after stroke. And last year, Vigo became the first digital therapeutic company in the Baltics to receive official reimbursement code from the Latvian Health Authority. So I'm proud and happy that we could be a part of their journey. One of the main elements of RIS is EIT Health Drive. So this is the support for the ecosystem development. And we will be opening a new call this year, a training program to develop healthcare startup support programs. In the course of our presence in the RIS countries, we have discovered that there is a strong need for healthcare industry focused support organizations. This will be published relatively soon. I again encourage you to contact our Latvian partner, Rīgas Tehniskās University. The call will be open to different organizations willing to work and create a program for healthcare startups. Accelerators, science parks, technology transfer offices can apply, but also many others. One more opportunity that I would like to mention is also morning health talks. So we offer a platform of networking for regional stakeholders, and Rīgas Tehniskās University organizes this meeting twice a year to discuss hot topics in healthcare and also introduce good practices and possible solutions from different countries. Two meetings are still ahead of us this year, so I again hope this will be promoted soon. And last but not least, when it comes to education, one of the hottest programs that we offer in RIS is Hello AI RIS. So there are two types. These are two types of online trainings program on artificial intelligence in healthcare, organized by GE Healthcare. We offer a certificate as well as ECTS credits here. The two types of the programs is Hello Advanced RIS. So this one is for more students and early career professionals with a strong interest in AI. The other one, which registration will be open soon, is Hello AI Professional, senior professionals, executives, and researchers. Here, background in healthcare and IT is expected. So those two programs are currently open. Thank you so much for your attention. I hope this was brief, but fairly understandable offer that EIT Health can provide for Latvia. I also encourage you to contact our EIT Health RIS Hub, Baiba Petersona at Rīgas Tehniskās University for more details of some of those activities. Thank you.
Thank you, Eva. Thank you. And especially for such a localized content of your presentation. Thank you very much, very useful. Any comments or questions or requests on health? By the way, also one question, is there any new challenges? Because I understand, of course, the programs are long-term events, but do you feel any new needs in your field?
There have been multiple new needs, starting from COVID and even now, with regards to what is happening in Ukraine. So we do have two initiatives. One is rapid COVID response, and the other one is rapid Ukraine response, where we gather needs and ideas of possible initiatives, both from our partners and the contacts that we have in Ukraine, for example, to meet those challenges and to help together as an organization.
Yeah, so quickly in these situations?
Sorry, could you repeat?
I mean, is it possible for you to react so quickly?
It is and it isn't. So this is very, I think it's a bit complicated than that. Of course, over time and as quickly as possible, we can organize an ad hoc startup competition, for example, for COVID solutions. But in long term, it requires a bit more time. We know that healthcare sector struggles to adapt quickly to the changes. So this is the current situation.
Understandable. Thank you, Eva.